a challenge for people who have kids that are younger than fifth grade, keeping them at a computer, busy all day with the attention span, etc. How will this evolve? Hypothetically, will the teachers be teaching via whiteboard or continuing to assign assignments that parents then need to print out, or is there going to be more cohesive technology?
Well, definitely, I think the last part. I mean, you remember, we basically in 2 weeks designed the distance learning plan that we're all used to. Again, I have young children. My children are 4 and 11, so I completely empathize with all the parents in that group. What we realize now, we're going to have to work closely with the union and get some contract language to help us make a much more consistent product, for a better lack of words, for all families, and that is age appropriate. So we have teams building that out now. You can see some of that on our website, but we absolutely recognize that now that we have the time, it must be much cleaner and much easier and much user-friendly. We even have developed and created a parent onboarding class to teach them how to deal with distance learning with their children. And so we're working through those things. We'll have much more details in the near future.
Okay, and what about testing? How will that be affected if kids are learning from home and maybe they don't feel they're getting the resources that they would get in person? Maybe they struggle with math or science and they feel like they're being tested and they're held accountable for something they fully don't understand.
Well, I can tell you this, myself, Alberto Cavallo in Miami-Dade and Bob Runcie in Broward, we've developed our own little mini consortium. We meet once a week. We're actually getting a meeting with the commissioner this next week. The truth is, you're starting to see it across the country. The state of Georgia just announced that they're asking the DOE to waive all standardized testing requirements for the upcoming year. I haven't heard that discussion out of Tallahassee, but we're going to broach that. I don't see how we can be held accountable to the same standard when we're going to be in this sort of red light, green light year of stopping and going based on COVID numbers. So that is something on my agenda to talk to the Tallahassee administration in Tallahassee about, and I hope they would be willing to waive those requirements.
Dr. Fennoy, where are we on summer camp right now?
So the interesting thing is we've actually begun opening summer camps on June 15th. Surprisingly, people didn't show up, or we had to close them down quickly because there was a massive COVID out, well, not massive, but there was a COVID outbreak in those facilities. So these were not camps that were run by us, but we were asked by the county officials and others to open our buildings to leases. And so that's kind of given us our first test. So they're open, and we're willing to open more, but we are very strict about the guidelines associated with that process and the number of kids. And so for some camp officials, it's not cost effective for them to do that. So they're open. It's just, and I think it's just up to the individual families who want to participate.
Well, you're obviously the largest employer in the county, and the virus has affected the district. Obviously, from a business standpoint, you manage the money you were able to recoup. Will teachers, though, get to choose whether they instruct from home or in person, just like the students? And will they be penalized financially if they choose to teach from home?
That is a very complicated question.
We got time.
I think, let me just say this. There are guiding contracts in place. There are guiding procedures, policies. And remember, as a school board, we have to be great stewards of the taxpayers' dollars. But we also understand there are certain groups of people that may not want to be in there. I mean, when I tell you, I think that is going to be the longest negotiating period ever, trying to figure that out, because, you know, we're responsible to the community. And so if families need their kids in those buildings, I have to have adults that are certified to be there, but I'm also responsible to the employees for their safety and health. So I don't have a real answer other than we're gonna have to work through this. And there's no playbook for this, and all of us are kind of giving you very non-specific answers to this particular question.
You know, one of the questions I find intriguing on the survey you sent out is about split sessions. How seriously is that being taken? And if you had to speculate, what would that look like?
So the split sessions was an early idea that was going around the country. We're still considering it. Donald Fennoy, not the superintendent, me personally, I don't see how as a parent, I can have my kids in school Monday, Wednesday, Friday, and not on Tuesday, Thursday. And I don't have daycare, you know, it's that might not, and then if just separating days by one day, does that really impact the health and safety of the buildings? So, you know, that's the tension, and, you know, so I tend to make my final decisions based on being a working parent with young children. And so I don't think the community would want me parenting and trying to lead the largest employer in the county at the same time from my office. So right now, personally, I think we have to kind of just go back to school and give parents the options to pull out when they see fit. But again, that's ultimately for the board to decide, and the team is still working through those pieces. But asking a specific question about my opinion on alternating days, I don't really see how that's possible. And even with the buses and transportation and work, think about a teacher who has to come to work, but they also have children. So how are you going to do that schedule? So we're working through those things, but we'll have answers really soon about that.
Challenge as a small business owner as well. One of the things you hit on earlier was the mental aspect. So will you be offering emotional support for parents and kids as well?
Yes, we started that several months ago. Thanks to the taxpayers of Palm Beach County, during our last referendum, we were able to afford close to 300 mental health professionals to be placed in every school and other ancillary facilities around the county. Obviously, all of that work went virtual over the last 3 months. The numbers are just through the roof. Our employee assistance program, all our psychologists were making home visits via Zoom. In extreme cases, we're sending police out. So, and then even now, getting back to school, I have an entire division that's just working on how to reacclimate people back into being in social spaces together. Dealing with the trauma that may have occurred from people being at home. Even though the cases of domestic violence, of reported domestic violence, are dropped, what we know from talking to our kids and even some of our teachers, that there's a lot of trauma happening in these homes. And so we're prepared to start dealing with all of that. We have great professionals, thank God. This community supported us a year ago so that we have the resources to do those things.
Okay, and we have some questions from people tuning in. They just wanted to know if aftercare is on the table, as well as field trips in the winter, which would seem a little speculative potentially at this moment.
Yeah, a little bit. I think after school programs will probably exist in some shape and form. They have to. Again, that's an extension of the school day. Many parents depend on that. So I have an entire team just working on those realities. And we're working with the Boys and Girls Clubs, the YMCA, all of our local agencies who also need to keep these programs running for their own sustainability. Field trips right now, the answer would be no. There are not a lot of places taking kids on field trips. But honestly, the biggest challenge is just the busing. So you can't put kids on buses the same way you once can. There's CDC guidelines, there's cleaning regiments. And so until we can get a better clarity on how to transport people, and let's be honest, what is even open for kids to go see, a lot of that stuff has moved virtual. So you'll see on our website, we have virtual field trips all summer. And the numbers of people accessing those things is out amazing to me. So they're taking trips of all the Smithsonian's, the African American History Museum in DC. We have kids doing that during the summer. A lot of our local places have virtual options, the Science Center, Loggers Head. So that is happening, but getting on buses and going places, it'll be a while, I think, before we're ready to do that.
Listen, Dr. Fennoy, I know you're busy. Thank you so much for taking the time. Keep up the great work, and looking forward to see what you unveil.
Thank you so much. You guys have a great weekend.
All right. Thank you so much to the superintendent. Now we're pleased to have with us Dr. Alina Alonso from the Florida Department of Health in Palm Beach County. As director, she oversees operations of one of the largest county health departments in the state. Dr. Alonso, thanks for joining us.
Thank you very much for having me. I'm going to share my presentation that I gave to the Board of County Commissioners, and I certainly hope that it's a little easier to do this presentation for you than it was at the Board of County Commissioners. So I'm going to go real quickly because some of the slides and so forth are just to give you is it being shared or not yet?
Yes.
Okay. So what you see here is what the map and the numbers for the global and the US cases looked like when we opened up, or the board meeting that I gave right before we opened up. And now you look at the cases, you can see everything has doubled. As far as our numbers here, let's see, how am I making this advance? As far as our numbers here, we can see that we have experienced a very sharp increase. When you look here at, these are the number of cases. Our highest case was 375 cases Today, we're down to 234. We have 234 new cases today, but you can see a very clear increase, a very linear increase. You can see our counties have remained, our southeast region has remained in dark blue. We have lots of positive and hot spots throughout the county. Our numbers in terms of the age, this is what bothers me right here. The 15 to 34-year-old. We have 132 cases of 0 to 4, 300 up to age 14, 1,000 and 1,500 in the up to the 34. These people are going into the hospital. There have been children in the hospital. But we have not had any deaths among this age, but we have had deaths in this age and this age. So this is a very serious virus. It is a virus, and we still don't know about it. That's why it's called a novel virus, because it's new. We don't know about it. So people complain that we've changed the rules. Well, when you're learning, sometimes you have to change what you've learned. I was one of the people that didn't think we needed masks in the beginning because, masks are only there to protect the person who is sick from giving it to you. But now that I see how this is spread, how I see how 16 kids end up in Jacksonville having fun at the bar and all 16 of them end up positive, I believe that masks do stop the spread of the virus. And so does the CDC, and so do many other people around, just from common sense. It doesn't have to be science necessarily. It's just, it makes sense. By having a barrier on your face, you're protecting yourself from things coming to you. And for me, one of the things it does is stops me from putting my hands touching my face. So this is a very old medical practice that was here forever, going backwards, even when people didn't understand anything about viruses or bacteria or anything else, and it was used. Quarantine's been used. It's a very primitive medical, but in this case, when you have a new virus that there's no immunity, your only tool is keeping people home, keeping people away from other people, avoiding large crowds, and the whole physical distancing that we're talking about the 6 feet. And then of course, hygiene in terms of washing your hands frequently, making sure you don't bring them to your face. And it's sad to have to tell people to wash their hands, but unfortunately, that's one of the ways that most people get this, is by touching something like a doorknob or something and then bringing it to your face. The virus doesn't jump off of the person onto you. You have to either breathe it in or have it brought to your mouth or nose to have it then go into your lungs. So it's pretty hard to catch from that sense, but that's how most people are catching it. So not to bore you, but this is a picture of, and I think if I put this on, this will look better this way. Okay. Can you see the whole thing, or are the pictures interfering with the slide?
We can see.
I know. Okay, so in early May, our numbers were averaging around here, they were averaging 68 cases per day. Our highest number prior to opening was 177. On May 20th, we had a spike. We blamed it here on some labs that had not come in here. And so we were concerned, but then we saw it go down, we were okay. Around this time, the numbers started going up, and all of a sudden our average became, from 68, it went up to 102. At that point, that was a 60% increase. From June 1st to today, our average now is 220. So more than 100% increase. So when things are doubling like that, we call that an exponential linear regression. In other words, things are doubling. That is not good. when we went into, when we started, one of the things that we were very proud of was that our line was going kind of like this, and it was going up a little bit, but the line just was barely going up. Miami went straight up, very, very exponentially, and so was Broward. So we thought we were doing things right here. And we were taking care of ourselves. We were really looking out, but obviously now we have to interact in a way that we stop this, because if this does not stop, then you end up fulfilling the predictions that they're making that we will be the next epicenter like New York. We do not want to get to there. So my plea to all of you in the business community is that you look at our county, you look at your businesses, and you allow the only tool that is available at this point, which is the physical distancing, the wearing of masks, the hand washing, and everything else, staying home if you're in high risk areas, high risk in terms of, and I don't use the 65 as a high risk. I think it's more the condition that you're in. I think there are some people who are 55 that have more dangers than a person who is 65 and completely well. But we also know that this virus does things that we still don't know very much about. And so there may continue to be changes as we learn more and more about it. So my zip codes here, these are showing the high areas. This is in Immokalee in Collier County, Henry this is Clewiston in Henry County. This is DeSoto County, Indiantown, Stewart, and our other Belglade. The Lake Worth area is really a very seriously hot spot. This whole area here, from Lake Worth Beach all the way out, all these blue areas are probably going to turn red very soon. They're on high numbers. But look what we have. I mean, we have above us and below us, we both have, this is the corridor where we work and play, right? People come from Martin County down, people from Miami come up. We talked about the businesses coming up from Miami, our beaches. We live in an area that is surrounded by different factors with the virus. We don't live in isolation. The virus does not stop at the border. So we have to think globally in terms of Southeast Florida and what that means to us and how we act and how we play going forward. The positivity is something that lots of people are talking about, and it's confusing because perhaps we didn't explain it very well in the beginning. Our new cases, of course, are very important, but the other thing that we were looking at was the positivity, and there's two different positivities. One is the positivity for the total people tested, and that basically is a fraction. You take the positive people and you divide by all the people that you tested. That gives us right now an 8.3 positivity rate. Does anybody remember what it was when we were all happy about it? It went all the way down to 4.9. And we were complaining because Broward was down to 2.2. And we were like, what is Broward doing that we're not doing, that we can't get it all the way down there? And that made sense to us. And we were very proud that we were doing the right thing by having people isolated and closing down businesses. Because what we basically were doing was starving the virus, right? In order for the virus to make people sick, it has to have people around an ill person, coughing or sneezing or transmitting the virus. If the virus doesn't have any place to go and it just drops down into the ground, then it can't make another person sick. So the virus needs people in close proximity in order to propagate and make more people sick. So in those terms, when we were looking at this positivity rate, we were showing that even though we were testing more people, because we really got to numbers quite high, that there were more negative people than positive people. So as long as this continued, this number would continue to go down. As a matter of fact, at one of the board meetings, we said, well, we can drop that indicator because, of course, the more we test, the more negative people we're going to have. So we expect this number to go down when the virus is dying off because we're not allowing it to spread. The other number that can give us the same thing, but from a different perspective, is the number of positive laboratory tests. So we call that the positivity for the labs. That means the number of positive labs for that day divided by the total number of labs for that day. Again, the less virus you have in the community, the lower that number was going to be. And the state chose 10% as the goal that we wanted to reach, because we were way up here, like 20, 25, 29. And so on May 9th, I believe, right around when we were closing, we actually, right before we opened, we had reached a low of 4.9. We were right around here, okay? As we have opened, our numbers have gone higher. And I can't see unless I can move this. Let me do, okay. Right now, we are at 8.9. That is not good. We're almost above the goal that we had set. We have lost all this ground. So that's why I say that, yes, of course, the more tests you're going to have, it makes sense that you may see more people, but you should be going down, not up, if the virus was not gaining space. If the virus was not gaining strength, that number would continue to go down, not up. So it's not that we're testing more, is that the virus now is more active than it's ever been. I would say it's at least 100% stronger now than it was when we first opened, because we have 100% increase just in the month of June. So I hope that explains it. If you have more questions about it, I will explain it better or try to do better. These are other indications, other indicators that we were looked at, and I am making the connection here, what it looked like when we were closing. Our emergency department numbers were going down, the cough-like symptoms were going down, our new cases were going down, and our positivity percent was going down. Here it is, it was on 426 at this point. And at that board, what I said right here, so I was a little concerned because this wasn't going down, it had become flat. And I said, I think we should be cautious at that board meeting, because this gave me a little feeling in my stomach that something wasn't right. I wanted this to continue going down. So I was hoping that maybe we'd wait a few more days, and maybe I didn't say it strongly enough. I keep saying, what else could I have said? Anyway, this is what it looks like now. Things are going up and definitely not down. And as I showed you, the positivity is way out here and our new cases have gone way up. So we need to now, so what do we do? The first thing I think we need to do is follow the governor's orders. In the reopening task force that was submitted, it said that we would open all these things, but we would do certain things. And the first thing it would be to follow the distancing and the hygiene and the cleaning and everything else. So we need to enforce what we said we were going to do. That's number one. And then the other things is to continue testing, to include asymptomatic people, and do more education and continue to do our contact tracing. We need to educate the people that we're testing, because they don't understand what they have to do yet, believe it or not. Some people think that if you test negative, that means you're negative for the rest of your life. You don't have to worry about the virus. That's absolutely not true. The only thing you do when you test negative, you're negative that moment. You could get positive in the next day before your test results comes back. We have to do more public messaging and emphasize the virus is not gone. It's here more than ever. We can see that because of the positivity rates. And we need the officials, we need to adjust public activities based on the viral load to avoid any surges, and everything that Superintendent was mentioning is exactly how we have to think about this. What we think today may change in the next couple of days because of what may be happening. But we have to do everything we can, because I believe that the most important things for the businesses to be able to remain open is if you as a group enforce these rules so that your businesses do not become the focal point of spreading the virus. It's as simple as that. It's just common sense. There's not a lot of science in here because the science is not helping us. We don't have antibiotics for this. We don't have medicines. We don't have anything else other than that physical distancing. And it's going to be very rough when November runs around, because we're going to have the flu, we're going to have the common cold, and at the same time, we're going to have this virus kicking around. So exactly what Superintendent Benoit was talking about is that it's going to be that mental anguish as, oh my God, I've got the virus. So we got to expect that. And with that, I'll finish so that you can spend time asking questions.
Thank you, Dr. Alonso. First and foremost, that presentation covered a great deal. So thank you for taking the time to put that together. Obviously, you mentioned masks, which is a contentious issue, a lot of tension around there. Some see them as essential, others as an infringement on their personal liberties. You said that we don't want to be the next epicenter. So with that in mind, is it too early to move into phase 2, in your opinion?
I think I've been very clear on that.
Yes.
I'm not ready to move into phase 2. I think everything that's been happening in the last few days makes that very scary. The fact that the governor exempted our 4 counties, the whole region 7. The Keys now has positive cases. That was really smart. They weren't letting people in unless you could fly in. That he was wise in doing that, and he did it specifically because our numbers have not gone down, and so we need to follow his lead. We need to follow the orders that are in the governor's orders to enforce those orders so that we can remain open at the level we are now and not have to go back to shutting people down. I'll be perfectly honest with you. I don't want to shut anything down. Mm-hmm. I am it's very hard keeping up the pace with what has to be done, and at the same time not be able to do the things that you usually do, not be able to relax and go have dinner out somewhere. So I am very careful. I have admitted that I have gone to a restaurant and they were very, very good. I won't say any names, but when I called, I asked them about 20 questions. And they kept saying, yes, yes, yes. I said, okay, well, I'll make reservations. And they were like, wow, okay, good.
Yeah. Here's a question from a viewer, Dr. Alonso. The amount of cases that are positive, is there further breakdown symptomatic versus asymptomatic? And what is the percentage of hospitalized positives, if you happen to have that?
I don't have that off the tip of my head, but yes, we're looking at all those things. Our hospitalization rate in Palm Beach County is a little bit lower than the rest of the state, and it's definitely lower than Miami and Broward. I don't know the percentage, but the other thing that we do so that everybody knows is that we're watching all the different indicators in the hospital. How many ICU beds do they have? How many do they have available? How many COVID ICU beds are they on? How many are in the hospital but not in the ICU, and how many ventilators? Those numbers have fluctuated. They went up like 5 days in a row, and we were nervous, and then they came down a little bit. The hospitals have a lot of flexibility with that type of situation. They know how to manage that. They move their rooms around and so forth. Their elective surgeries were able to open up because they had made enough room, and those numbers had gone down. So if they get in a crunch where they actually have to cancel elective surgeries, that's a way that they can move more patients around. But it's not so much the number as the intensity. When you have a COVID patient in the ICU, you have to have a 1-to-1 ratio with the nurse and the patient. So imagine you have an ICU with COVID patients all at one time, that's very difficult to maintain staff, and it's a much higher intensity than if you just got the guy that's recovering from surgery for a couple of days and he's going to go back to the floor and he's already walking around on his own. Okay, so it's that intensity is much more important than the number. But right now the hospitals are fine. But what we want to do is to be able to enforce things so that we don't drive this number higher and have those younger age end up in ICU.
Well, Dr. Alonso, a lot of questions were pouring in for you. We have one last question. As we get closer to the vaccine and knowing there will be a limited supply, how does Florida and Palm Beach County make sure that they secure some of this vaccine?
We have a vaccination plan that we have practiced since anthrax. In the event, whether it's vaccine or medication that we have to give out, our county here in Palm Beach County, Broward, and Miami are all city ready counties that are ready to be able to vaccinate or give out medication to our whole population within 2 or 3 days. We call those points of dispensing in case we have to then give out vaccine. It's going to be very tricky because we have a whole group of people, the same group that don't want to wear masks, don't want to get vaccinated. And at this point, they have no trust at all at the government. They don't trust anything. And there's another group that the fact that the FDA is waiving some of its necessary precautions and testing guidelines, I am afraid that this vaccine is not going to be seen as something that everybody's going to come running for. So that concerns me a little bit, because the virus will go away at the point where we have 60% of the population either has had is either immune because of antibodies, because they've had the disease, or the vaccine then covers the rest of the population. If a lot of people still have not had the disease and a lot of people don't get the vaccine, then this will last much longer than we expect. So let's say we get the vaccine for the flu season and we can give the flu and the vaccine all together at one time. If enough people don't sign up for that, we're going to still see spikes.
Dr. Alonso, there are so many more questions. We're going to have you back because we could do a whole hour with you. So thank you so much for taking the time. I do know that people would like your slides, so we're going to try to make those available to everybody. We appreciate your time. And we now are going to segue to our next caller on the line, and we're pleased to have Palm Beach County Mayor Dave Kerner give us a current county update on Palm Beach County opening and the $16 million for small business grant. Dave, thanks for taking the time.
My pleasure. I trust that all of the questions were answered by my colleagues, Dr. Fenoy and Dr. Alonso.
Absolutely. Have a good day. No, if you could, give us an update on what you're seeing. And at some point, do you think masks should be updated in Palm Beach County? You heard Dr. Alonso say that absolutely we should be wearing masks. What can the county do?
Well, first and foremost, let me tell everybody first, thank you for having me here today. Today is a very busy day at the Emergency Operations Center, which is where Dr. Alonso is stationed, as am I. I'm currently at the County Governmental Center because of a Palm Tran bus operator graduation that I just presided over. But Palm Beach County is in a very good place. Certainly there are metrics and numbers that show an increase in the positivity rate, still below 10%. And obviously a great deal of community spread. And that's not confined to just those zip codes that were probably talked about both in the news and by Dr. Alonso. Those are hotspots, Lake Worth Beach and Jupiter, and then out west in Belle Glade, and certainly some counties around us like Hendry and the city of Immokalee. We have a general trend higher, and it's starting to become concerning. So with regard to the second part of your question, yes, I think we're at a point in saturation in this community with the community spread that it is my public position as a policymaker. Again, I don't make these decisions in a vacuum, and I don't make them on my own. But I think that when the board convenes next on the 25th, we do have this issue on the agenda, and I will be supporting an ordinance similar to those in Broward and Miami-Dade.
And what happens if people don't adhere to that and they choose not to wear masks?
Well,
If this passes?
well, first of all, this is a civic duty. I've always said since day one that we all have personal responsibility and we all have a civic duty, and how we uphold that civic duty will vary based upon our age and how active we are in the community. But remember, the governor's order is the law. Then if we pass an executive order, and although we do it carefully and cautiously if it infringes on personal liberty, it is the law. Now, does that mean that the police and sheriff's office will be out there citing people or taking them to jail for not wearing a mask? No, we're going to have reasonable accommodations. And our hope is that those that are patriotic and care about the health, safety, and welfare of their community are going to do what the law requires.
It's about respect and understanding. And meanwhile, if we can just zig for a second, can you give us an update on the 60 million for businesses?
Yes. So let me say that a lot of the things that people don't see behind the scenes that I have an opportunity to see operate in this government, such as convening a group of professionals to process, review, and ultimately distribute these funds as part of the CARES Act at the county level, has been an amazing transformation. Obviously, we are not DEO. We are not an unemployment agency that's accustomed to mailing out thousands of checks after doing our due diligence with the clerk. But they really did an incredible job, and I'm confident, because I get reports daily, that we're going to max out the $60 million that we have set aside. And I'm going to encourage the board, and I'm going to encourage Ms. Baker to allocate further funds for the small business grants. But I've received literally hundreds of emails, thanking me. I didn't do anything. It's not my money, but thanking the Board of County Commissioners and the government for getting that money out onto the street, and then and doing it in a way that upholds the due diligence that should be required when we're giving a grant out that's really non-refundable or doesn't need to be returned to the government.
So at this week's commission meeting, it was suggested that even though positive cases continue to increase, the county's prepared to move into phase 2. What are your thoughts on that?
Well, there's some confusion amongst the members of the press about what phase 2 and what my request actually said. As you know, I served on the executive committee of the Reopen Task Force appointed by Governor DeSantis. And what he has decided is that he would like to interface directly with the 3 county mayors, that is Palm Beach County, Broward County, Miami-Dade, not in an official capacity, but in a way that gives advice and makes certain requests to the executive office of the governor. And so, after taking the temperature of my colleagues on the board, it was my judgment that we were ready to move into a very limited phase 2. So basically, it's not phase 2 in the full sense of the word. It would only allow those bars that are attached to restaurants with seated service to open, and then anything else would have to come through a very stringent application process through the county, which I'm involved in as well, because each entity that opens up needs to be signed off by the county mayor. And so I've been in constant dialogue with the executive office of the governor, his chief of staff, and the governor as well. Obviously, we have some concerns as more data comes out. It is actually between the time I sent that letter and then that Sunday, a new data drop came, and I got a call from Dr. Rivkes, who's the Surgeon General. And so right now we have it on hold a little bit. I go back to what Dr. Alonso said, and she has sort of an inside scoop on this, is that we'll be announcing at 4 o'clock today. Excuse me. We'll be announcing at 4 o'clock today. That was just my throat sore. I don't have any other sickness. Our COVID education and compliance team, which is a team made up of law enforcement from around this county, our sheriff's office, our fire marshal, and members of the code enforcement community. And what we're going to do is, in addition to the mask issue, and in addition to all the other phase entries that we can go into, if the rules of the road aren't respected and abided by, then it doesn't matter what phase we're going into. The law needs to be complied with. So the point of this education and compliance team is twofold: primarily to educate and put PPE out into our business community, and then B, where necessary, where there are abject violators of the law, and they do exist, and people text me these names of these restaurants and businesses all the time. Unfortunately, if they don't want to comply with the governor's law, then this team is going to go in on an apolitical basis. I'm not going to be involved after we launch it today at 4. And they're going to go, explain how this is going to work. And then if that business owner doesn't want to comply, then there are going to be some sincere ramifications. I cannot tolerate community spread because of people's negligence or unwillingness to comply with the law. We can educate, we can assist, and ultimately we will have to enforce.
So Dave, last question. If we do move into that revised phase 2 and the numbers continue to rise, how realistic that we would move back to phase 1 or even worse, lockdown?
You know, I don't want to speak on behalf of the board. I have some limited powers as a county mayor, but certainly when we get into selection of phases or retreating from an economic standpoint, it is important that I seek the input of the board of county commissioners. I don't foresee us in the immediate future, or it's not of immediate concern that we would retreat. I don't think that is any concern about us being at that threshold point. Certainly the numbers and trends are not positive. Well, they are positive in one sense, but they're not good for the community in the other sense. But really, I think with a robust level of enforcement and in education, that we're going to start to see a turn in the corner here in Palm Beach County. And of course, there's a litany of other very community-directed actions that we're taking within some of the more challenging communities to make sure they're well aware, well-informed, and educated, and that they have the read. But Palm Beach County can do this just like other places in this nation. We can learn how to adapt to this new normal, but sometimes we need to remind the community that this is not behind us and we have a challenging and long road ahead. This would not be a pandemic if it didn't have its unique challenges to each community.
And Dave, will you be holding a televised news conference to update people after Tuesday's hearing, or will we be doing anything ahead of time to warn people prior to Tuesday's meeting about these new rules that you had potentially said could go in place?
Yeah, so typically I try to be accessible to the press at all times, but formally, typically at 4 o'clock on Fridays, I'll hold a press conference as long as there's information that needs to be put out at that moment in time. I have one today at 4 o'clock. But I don't want to get ahead of myself because we did elevate this to the board. So if the board does decide to go with mandatory masks, which I do support, then we will certainly hold a press conference and also start to give updates on our COVID education and compliance team.
Here's a question from a viewer. Is the county looking at providing a COVID tracing app based on Apple or Google API like they have in Germany and contact tracing?
Okay, so I'm not the technology guy, and everyone will back me up on that, especially the people that I work with. But what I can tell you is we are leading the way, just like we're leading the way with the COVID education and compliance team. I was very insistent that this county move forward on technology, and it's really Bluetooth technology. I don't think America, maybe unlike Europe, but America has some concerns about government intervention and using GPS to track people from a government standpoint. So we went ahead with some Bluetooth technology and engaged an app developer to help us be able to notify people that they have COVID or they've possibly been exposed to it. And so that app is going to launch here in a week or so. And I know that Broward and Miami-Dade are looking at technology so that we can combat COVID. That's the name of the app. So that we can combat COVID from a regional perspective.
And obviously we have to take people's word for it. Do you think they'll be honest about reporting that they have COVID?
Well, it's totally voluntary. First of all, there's a lot of utility to the app aside from the Bluetooth technology. And yes, I think humans and Americans in general are inherently honest and inherently have a civic duty and spirit to make sure we all stay safe. If you're referring to the possibility of like what do they call it, a Zoom bomb or whatever, where you kind of punk people through the internet, you know, I hope that doesn't happen. If we do encounter things like that, which I don't think we will, we have a backup technology within that app that would require verification through the physician's office that provided the positive test result. But these are the sort of the balance and tension of having a nation that hasn't gone through a pandemic like this before. It really is at the county and local government level that we're pushing these initiatives and finding what works and what doesn't. And there is a little tension and balancing act that needs to go on with that. But I think technology plays an important role. And so I'm excited to see how the rollout of Combat Code app is here in Palm Beach County.
Thank you, Dave, for taking the time. So as a recap, you have a 4 o'clock availability to the media. Commission voting on Tuesday about the masks, with what you say is about respect and understanding, and you will be supporting that as well. And I do believe we have one more comment here, and that is from Dr. Alonso before we wrap. Dr. Alonso?
Yes, I just wanted to say, we also the state used an app and it was not very good. The people used it maybe 2 days and then they stopped reporting their temperatures and so forth. So we had to go back to telephone calls and talking to them. There's a lot of problems with barriers and other things. So maybe in the future that would be helpful. Right now, we're hoping that the app that the county has come up with will help more than the one that we had at the state. It wasn't very good.
Well, thank you very much, Dr. Alonso. Thank you so much, Dave Kerner. Thank you, Superintendent Donald Fenoy. Thank you all for taking the time preparing for this call so that we could benefit from your insights, experience, and information. Thank you to our friends at ESPN West Palm 106.3 for airing this call to their listeners. We encourage the business community to tap into these resources on bizhelppbc.com. That's bizhelppbc.com, where they'll be updating information around recovery efforts. I'm Corey Sabin. Stay healthy, stay safe, have a great Father's Day. This call is now concluded.